Hello everyone, welcome back to my channel. Today we are going to learn about collection, preservation and transportation handling of urine sample. From our previous video, we know how urine is formed and from where it is formed. Urine examination reveals the state of function of the kidneys. Routine urine analysis is a simple test and when done correctly is very useful in diagnosing diseases of the urinary tract. The clinical information obtained from a urine specimen is influenced by the collection method, timing and handling of the specimen. Okay, now we'll get into the collection and handling of urine. A vast assortment of collection and transport containers for urine specimens are available. Determining which urine collection method and container should be used depends on the type of laboratory test ordered. Urine should be collected in a clean, dry, and preferably sterilized container. Laboratory urine specimens are classified by the type of collection conducted or by the collection procedure used to be obtained the specimen. The majorly used types of urine collection are random specimen collection, first morning or early morning specimen, midstream clean catch specimen, catheter collection specimen, suprapubic aspiration specimen, pediatric specimen, and 24-hour urine collection. First, we are going to see about random urine specimen. This is the specimen most commonly sent to the laboratory for analysis primarily because it is the easiest to obtain and readily available. This specimen is usually submitted for urine analysis and microscopic analysis, although it is not the specimen of choice for either of the tests. Random specimen can sometimes give an random inaccurate view of a patient's health if the specimen is too diluted and analytic values are artificially lowered. Pediatric specimens, which routinely undergo chemistry and microscopic analysis, are generally of this type. As the name implies, the random specimen can be collected at any time, although there are no specific guidelines for how the collection should be conducted. Avoiding the introduction of contaminants into the specimen is recommended. Next, we are going to see the first or early morning urine specimen. This is the specimen of choice for urine analysis and microscopic analysis. Since the urine is generally more concentrated due to the length of the time urine is allowed to remain in the bladder and therefore contains relatively higher levels of cellular elements and analytes such as protein. In this type of collection, the patient will empty his bladder before going to bed and he is going to collect when he wakes up in the morning. This will be called as early morning sample. This type of collection is also called as 8-hour specimen collection. Next, we are going to know about midstream clean catch urine specimen. This is the preferred type of specimen for culture and sensitivity testing because of the reduced incidence of cellular and microbial contamination. Patients are required to first cleanse the urethral area with a Kesile soap and toilet. The patient should then void the first portion of the urine stream into the toilet. These first steps significantly reduce the opportunities for contaminants to enter into the urine stream. The urine midstream is then collected into the clean container. Any excess urine should be voided into the toilet. This method of collection can be conducted at any time of the day or night. In this picture, it has given the instructions to collect the midstream urine. The urine container cap should be opened just before the collection of the sample. Next, we are going to see the sample collection from a catheter. This assisted procedure is conducted when a patient is bedridden or cannot urinate independently. The healthcare provider inserts a Foley catheter into the bladder through the urethra to collect the urine specimen. Specimens may also be collected through an existing Foley catheter. Specimens may be collected directly from Foley into an evacuated tube or transferred from a syringe into the tube or cup. Okay, next we are going to learn about suprapubic aspiration of specimen. This method is used when a bedridden patient cannot be catheterized or sterile specimen is required. The urine specimen is collected by needle aspiration through the abdominal wall into the bladder. You can see the procedure in the right side picture. Next, we are going to see pediatric specimen collection. For infants and small children, a special urine collection bag is adhered to the skin surrounding the urethral area. Once the collection is completed, the urine is poured into a collection cup or transferred directly into an evacuated tube with transfer straw. In pediatric collection, urine collected from a diaper is not recommended for laboratory testing since contamination from the diaper material may affect test results. Next, we are going to see 24-hour urine specimen collection. The laboratory services provide 24 hours urine collection containers with various types of preservatives depending on the test requested. It is recommended that all timed urine collection be kept refrigerated during the collection period and brought to the laboratory as soon as possible after completion. Here, we have to inform the patient about the presence of potentially hazardous preservatives in the collection container. Instruct the patient to discard the first morning specimen and to record the time of voiding. The patient should collect all subsequent voided urine for the remaining of the day and night. On the second day, collect the first morning specimen at the same time as noted on day 1. This voids completes the 24-hour sample collection. Okay, now we are going to learn about preservation of urine. Urine should be examined fresh within 2 hours of collection. In case of any delay or 24-hour sample collection, use of preservation is required. Refrigeration without using any preservatives can also be done for short periods. Some of the recommended urine preservatives are formalin, thymol, chloroform, boric acid, and 50% of acetic acid. These can be used in preservation of urine in instructed quantities. Now we are going to see the transportation of urine sample. As with any type of laboratory specimen, there are certain criteria that need to be met for proper collection and transportation of urine specimens. This will ensure proper stability of the specimen and more accurate test results. The collection and transport containers should have a secure lid and be leak resistant. Leak resistant containers reduce specimen loss and healthcare worker exposure to the specimen while also protecting the specimen from contamination. Specimen containers should not be reused. Transport tube should be compatible with automated systems and instruments used by the lab. Here we have some guidelines for urine specimen handling. The first guideline is labeling. It includes the patient name and identification on the labels. Make sure that the information on the container label and requisition matches. The label should be placed on the container and not on the lid, since the lid can be mistakenly replaced on different container. Ensure the label used on the containers are adherent under refrigerated conditions. The next one is volume. Ensure that there is sufficient volume to fill the tubes or perform the tests. Underfilling or overfilling containers with preservatives may affect the specimen to additive ratios. The next one is date and time of the sample collection. Include the collection time and date on the specimen label. This will confirm that the collection was done correctly. For timed specimens, verify start and stop times of collection. Document whether time at which the specimen was received in the laboratory for verification of proper handling and transport after collection. The next guideline is method of collection. The method of collection should be checked when the specimen is received in the laboratory to ensure the type of specimen submitted meets needs of the test ordered. The next guideline is light protection. Verify that specimens submitted for testing of light-sensitive analytes are collected in containers that protect the specimen from light. So these are some guidelines which should be followed while handling the urine samples. So guys, in this video we saw methods of collection of urine. preservations and preservatives used in urine collection, transportation of urine sample, and sample handling guidelines for urine. I hope guys this kind of my effort will help some of you out there in learning of these topics. If you like my video, please like, share and subscribe. Don't forget to subscribe my channel and comment your suggestions. And thank you all for watching my video.